Got some breaking news. Administration officials confirmed to Fox News that the Trump administration is now considering an executive order that would make it easier to buy cheaper health care plan without Obamacare mandates. James, what kind of fuss do you think this would cause?
Yeah, a really good fuss, because this was one of the central falsehoods. Let's not call it a lie. Maybe President Obama didn't know how far the plan would deviate from what he promised, but we were promised cost containment. We were promised affordability. We didn't get it. This is one of the reasons we need reform. And if it's a signal that the Trump administration is going to push as far as they can administratively to lower costs for consumers, to allow us more choice, maybe to allow states to try different things and give us more affordable packages, that's really good news.
By the way, Cabot, the fact that the individual mandate is now gone as a result of the tax plan, or it will be after the first of the year, did you know people, particularly young people like yourself, who figured, I don't need a health insurance, who were willing to pay the fine instead of buying in an Obamacare program?
I absolutely did. I know I have a lot of friends who said, I'm going to the doctor once or twice a year. Is it really worth it for me to pay these high rates and to subsidize some of the older people who are going far more often? I'll just take the penalty. And on this particular instance, I think it's important to point out also the number of districts and counties where there's only one provider there in those districts and places. And so I think it's always a good thing, open up the market, get as many opportunities for people as possible, because, as you said, we now know that the promise of affordable health care and of keeping your doctor if you want it ended up to not be true. So I think you're never going to hear a complaint from me on opening up the market.
Meanwhile, James, we got rid of the individual mandate, but small businesses or businesses with more than 50 employees are still stuck. They still have their business mandate, right?
Yeah, I think, you may see some legislative, I should say more administrative action to try and relieve that burden. I'm kind of skeptical that they can get any more through Congress this next year. I know the president is hoping to go further, but I think maybe we ought to take a moment to appreciate what's just happened. The elimination of that individual mandate is huge, and this is the beginning toward moving back toward a real market where you have consumer choice as the driver instead of government dictates.
And it gets back, Cabot, to that main question of coercion of government, and which is more important, the welfare of everybody, which actually goes pretty much unfulfilled when the government promises welfare for everybody, or the fact that you're forced by government to do something that you may not want to do.
And that was the big Supreme Court case. So is it constitutional to force people to do this? And that's a huge blow to the Obama legacy now. That was a huge victory they counted, and now it's been effectively erased within the first year of President Trump's administration.
You know, the most effective argument, James, for me on that was, we all know it's healthy to eat broccoli, but a lot of people hate broccoli. I remember President George, the first George Bush, hated broccoli. So what would happen if we forced people to do things to be healthy that they really didn't want to do? And actually an example of that was buying insurance that they felt they didn't need.
Yeah, and I'm hoping this is also a sign that Washington has really turned, where it's been frustrating watching the last year where people are still accepting the Obama premise, which is we're going to define healthcare success by how many people are enrolled in government programs. Yeah. That is not the measure, and it doesn't guarantee you'll be healthy. The fact that you're spending lots of money on government programs, it doesn't guarantee good patient care, that people are enrolled in a federal program. So this is actually addressing what people care about. Quality of service and cost, the latter in particular.
And very quickly, young people, as I remember from long ago, don't like to be told what to do. Isn't that argument, I mean, if you're looking for argument on the libertarian side in order to get millennials over to that side, isn't that a good argument?
Absolutely, and there was a lot of misinformation about Obamacare. A lot of young people didn't realize how it would affect them. They just heard healthcare for all, healthcare is a human right, this is good, let's pass this. And then they realized, wait a second, so I have to pay into this plan? Wait a second, what's going on here?
Cabot and James, wonderful to have you for a whole hour. I feel fortunate and blessed.